Welcome back to Cheddar. Oregon is beginning to see a slowdown in the spread of the coronavirus across the state 1 week after the state imposed a statewide stay-at-home mandate. Until now, Oregon has been pegged as an ill-prepared state for an unexpected surge of patients with the lowest number of staffed hospital beds per 1,000 residents. Now, state health officials are changing that narrative, simply saying staying home to save lives is working. Here with us now to discuss Oregon's response is Representative Greg Walden from Oregon. Congressman, welcome to the show.
Hey, it's good to be with you. Thank you. And thanks for your focus on my great state of Oregon.
It is a great state. I'm actually a big fan of Oregon, spent a lot of time there. Congressman, officials say Oregon's stay-at-home order has helped reduce transmission of the virus by up to 70%. That's a staggering number just in that state alone. What would you tell lawmakers in other states that have chosen not to go through with these stay-at-home orders? Let's say North Dakota, South Dakota, Nebraska, Alabama.
Yeah, I think to stop this virus, given we have no known treatment or vaccine, we have to go to basic public health protocols. Isolation, staying at home, as painful as it is, especially those of us from the Northwest that don't want to be cooped up, is really important in these times. It does work. It is having an effect. I listen to Dr. Fauci and Dr. Birx and the rest of the administration team as they're having these discussions. I rely on their data and science. We ought to follow it.
And health officials are saying they're cautiously optimistic that Oregon is ready for what's to come amid the pandemic. I have to say, Congressman, health officials aren't feeling very optimistic about a lot of things, so that's quite the compliment. What else has the state done to prepare for the worst as it makes its way?
Well, you know, we have a good network in place of healthcare. It's something we pioneered decades ago when I was in the state legislature and ever since. And it's really community-based. And there are already systems in place for our community coordination organizations, the CCOs, to be able to look at all the resources in the community, figure out what's needed, and then they all pull together. This goes on every day. Forget the pandemic for a minute. This is how we operate in Oregon. It's why we can run, as you mentioned in the opener, limited number of staff per hospital bed. We actually run very efficiently, very affordably, and have great outcomes as a result, both financially and in terms of quality of care. Obviously, everybody has to surge in a situation like this. Now, the one thing that I'm going to flag for you that I think is really critical, and that is our rural community hospitals are struggling financially right now, in large part because the governor shut down any elective procedures. And so this is something we're going to have to get our hands around, because some of them are losing half their monthly revenue streams, like the hospital in Grant County in my district, because they can't do any elective procedures. And so the revenue that they used to get that would keep the doors open, they're losing. So part of the money that's coming out to states such as Oregon with the FMAP increase, the Medicaid payment increase of 6% from the federal government, needs to be targeted and focused in on these rural hospitals that literally are going broke right now.
Such an important factor. Thank you so much for flagging that, Congressman. And one big global concern over the last few weeks as more people work from home is the stress being put on the internet bandwidth. What can you tell us about the efforts to keep our online activity secure?
Well, those are really good questions. First of all, if you compare the United States capabilities during this period to those of Europe, where they're calling on major providers to slow down content or diminish its quality, if you will, to free up broadband. We're not having to do that here in the U.S. We have a different light touch regulatory scheme here, and so I think it's proving to work effectively. I commend the carriers who have lifted the data caps, who have gotten rid of the penalties and fees during this period. They're stretching these networks as broadly as they can to help people get connected at home. The FCC has led this effort under Chairman Pai with the Connect America program. So there's a lot of really good things happening here. But look, we've got to maintain better vigilance of our networks. We know they're ripe and open to attack by bad state actors. We need to harden these networks, strengthen these networks, get unreliable equipment out of these networks. As former chairman of the Telecommunications Subcommittee in the House and chair of the full Energy and Commerce Committee for a couple of years, I know this stuff. It has to happen. And then I think for our platforms, they're doing such a great job of being so innovative. They've got to realize they have new users on. If you think about some of the conferencing platforms that are in the news, they never expected this surge, but they've got to be very transparent about how a user's data are being used, what the privacy settings are. Make those just really easily available, understandable, and usable. I think that would be my my suggestion to these platforms: be very transparent. You have a whole bunch of users trying to fire things up from home. You got the kids crawling around them, everything else. They're trying to do conference calls. It's the gig economy all at once, and it's in, you're like in my case, my wife's office, corner office area, she cleared out for me to make it Studio B. So we're all trying to adjust, but I think what we're doing is working, and I think we're really leading the world in this effort.
Fantastic insight, Congressman. Very quickly before I let you go, as we're all heading into the weekend, what advice do you have for Americans to help continue the efforts of stopping the spread?
I think it makes sense, especially in more congested areas, start wearing masks. I mean, there are a lot of sewing circles literally in my hometown and towns all across my district and across the country. They're making these masks. My wife made some for us. I'm probably going to start wearing one just because I should. And so I think you do that. The hand washing, distancing. If you don't have to go out, don't go out. If you go out, maintain the distancing. Take this really seriously. This is the best thing we can do right now to try and flatten this curve and stop the spread. And if you're young and healthy and think you're, nothing's going to happen to you, that's not the point. You may spread it to somebody who's not, and that might be a friend of yours who you don't even know has an underlying health condition that could put them in peril, or a parent or grandparent. So be smart, be safe, be healthy, and let's get through this together.
Be smart, be safe, be healthy. Representative Greg Walden from Oregon, we really appreciate your time. I love your studio, Congressman. Stay safe. Thank you so much.
Studio B.